In today's GBMC Rx prescription for a healthier you, nobody wants to be in pain all the time, but sometimes there are ways to manage it. Dr. Christelle Saman is an anesthesiologist and pain management specialist with GBMC and joins us now. Welcome to the show.
Thank you for having me.
I'm happy to have you here. Let's start out by defining the different types of pain that people can experience, because it's not all one and the same.
Absolutely. So there's nociceptive pain, which is injury to tissues, muscles, tendons, bones. And you can kind of think of, stubbing your toe or knee pain due to arthritis as one of those types of nociceptive pains. And then there's neuropathic pain, which is a nerve-mediated pain. So that can be the result of inflammation or injury to the nerve. And you can think of sciatica, so sciatic nerve pain is that type of pain. And there's also a pain called nociplastic pain, which is actually pain in the absence of any identifiable injury to any tissue or nerves.
Providers often ask patients to rate their pain on a scale from 1 to 10. So how accurate or helpful is that self-assessment?
Sure. So rating your pain from a scale of 1 to 10 does provide some insight, but it's also very important to actually be able to identify how pain is actually affecting people's day-to-day life and activities and their hobbies, because you can get a lot more of insight on someone's function in that way, and that can be very helpful. There are also certain patient populations that have a hard time actually providing numeric values, such as patients with dementia. And so really being able to use certain scales that capture someone's functional capacity and their function is very important.
And talk about pain tolerance, because I know that varies as well.
Sure. So some people might say, they have a higher pain tolerance or they have a shorter pain tolerance. And there are also some patient populations who historically have been thought to have higher pain tolerances than others. But what research has actually shown is that pain tolerance varies actually based on certain age groups, as well as types of pain. And so again, it's very important to actually really get a better understanding of patients' function and how what they're experiencing is affecting their day-to-day life. It's also important to remember that by definition, pain is actually subjective. And there is a component of it that's also emotional. And so those factors are very important to remember.
I'm glad that you're mentioning that, because this pain is often, not visible.
Right.
And so those with chronic pain can be discounted. So what advice do you give to them when they are actually experiencing this pain, but they're not necessarily heard?
Right. So one thing that I think is very important and that I often encourage patients as well as, friends and family alike is to make sure that your care team is one that you actually trust, because trust is a very important part of the therapeutic relationship.
And how do you identify and treat pain for individual patients? What do you do?
Sure. So when patients come to see me, there's quite a bit of time that's spent actually talking about the pain, describing the pain, questions that I ask to get a better understanding of how it's affecting their, everyday activities, how it's affecting their hobbies, how it's affecting their job, and the things that they do as well. We then go into a discussion on the things that they've tried, how those might have helped or not helped. We do a physical exam. I take a look at, if they have any imaging studies or laboratory studies, take a look at those things. And then we spend some time talking about what's going on. I very frequently will pull out my spine model, and kind of show them what is going on kind of at the anatomical level. And then after that, I lay out treatment options for them. So physical therapy is a part of a treatment plan that's very important. And so I will very frequently prescribe physical therapy, or, we'll have a discussion on their home exercise program. And then I'll let them know about treatment options ranging from medications, supplements, lifestyle modifications, as well as some injections and minimally invasive procedures if that's appropriate for them.
And so there are things that we can do at home. So how do we know how to do these things at home to manage our pain, and how do we know when that's enough and now we need to come and see you?
So I think an important kind of caveat to that is, being able to know the type of pain associated with a heart attack, right? A brain bleed, a bowel obstruction. So in the absence of those things, once you've been trying over-the-counter medications, the next step typically is to, chat with your primary care physician and to get some help, maybe with a physical therapy prescription or some imaging. And, if pain is still constant throughout the day. It's interfering with your ability to really, function.
Live a normal life, yeah.
And then it becomes important to come and see me, and it's a blessing to be able to walk people through that journey.
Yeah. It sounds like it's a constant dialogue and sort of meeting them at every level. It might start out small and escalate, or the opposite way, but they need to be in conversation with you.
Absolutely.
That is great. All right, I want to thank you so much for being with us. And of course, to learn more, visit gbmc.org/pain management. We'll be right back with more Midday Maryland right after this. Stay tuned.